Bismillahir Rahmanir Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. This parasitology lecture is about Taeniasis. This parasitic disease is caused by the cystodes, which are tapeworms, Taenia saginata, and Taenia solium. These worms are hermaphrodites. By hermaphrodite, we mean the worm is containing both the male and female organs. The definitive host, which is the primary host, is man. The intermediate host, which is the secondary host, for Taenia saginata is the cow, and for Taenia solium is the pig. The infective stage is the cysticercus. This cysticercus is an embryo encysted in beef or pork. The infection is by ingestion of the infective stage in raw or undercooked beef or pork. After ingestion, the cysticercus exists in the small intestine, and then the emerging young worm grows into adult tapeworm in about 3 months. The adult Taenia saginata is about 8 meters long, and the adult Taenia solium is about 2 meters long. The body of the adult tapeworm is known as strobila. It is composed of segments, which are also known as proglottids, at different stages of maturation. Mature segments are located away from the head, while young segments are located near the head. Segments of variable lengths detach and pass per rectum. Some segments disintegrate in the intestine and release eggs, which are passed in stool. Segments which are detached and pass by rectum move and reach the grass to be eaten by the cow or a pig. These are the intermediate hosts. You see here the pictures of the tapeworms. Cysticercosis, this is a disease entity. Some eggs of Taenia solium hatch in the intestine. The embryos which come out of the hatch eggs penetrate the intestinal wall and then enter the blood and reach different tissues, probably brain, and if brain affected, this leads to cysticercosis, which is a serious neurological disease. The clinical manifestations may be mild abdominal pain and epigastric pain, but in case of cysticercosis, there will be neurological dysfunction. Diagnosis laboratory by identification of the expelled segments, maybe one segment or more, then by microscopic identification of eggs in stool. Both eggs of Taenia saginata and Taenia solium look like each other in weight preparation, but can be differentiated if they are stained with modified Z-Nelson. The egg of Taenia saginata is acid-fast on your right-hand side, while the egg of Taenia solium is non-acid-fast on your left-hand side. You can differentiate by the scolex, which is the head. That of Taenia saginata has a cubical shape and it is about 2 millimeter in width with 4 suckers and no hooks. While that of Taenia solium is round, about 1 millimeter in width with 4 suckers and hooks, and rostellum. Rostellum is the protrusion above the head. Now you can see the pictures and the red arrows. Then you can differentiate between the two by the segment. Uh, if you press a segment between two glass slides and you look that under the microscope, you are going to see the uterus with its lateral branching. In case of Taenia saginata, the lateral branches stemming of the main central uterus, their number is 13 or more, one side, while less than 13 in Taenia solium. Taenia saginata, 13 or more, Taenia solium, less than 13. The treatment, the best drug is praziquantel, followed by nucleosamide. To a certain cure, to say the whole worm is expelled, make sure that the head is expelled because the worm can regrow from a remaining head. Otherwise, if you find that the egg is the head is expelled, that is okay. This is a cure. If you do not find it, reassess 3 months later. By this, the lecture is over. I hope that it is understandable and I wish you all the best.